Ready. My name is Mary Elizabeth Stennett, and this is the Ethical Analysis PowerPoint presentation on physician-assisted death. Ethic as it's applied to the topic. Physician-assisted suicide is not new, but in the recent past, it has become a very hot topic, and it is considered a basic human right. But is it? Or does it infringe on the ethical concept of do no harm? That is one of the first ethics that is being taught to physicians. With PAD, we're thinking that a patient is better off dead. But are we sure? Since no one has ever returned from the dead to tell us if this is true. Since PAD is usually patients that have cancer, and from what we know, it can be painful. However, we have made breakthrough in treatment, and palliative radiation and chemotherapy can reduce the pain in certain type of cancer. I am not for physician-assisted death. The physician, as a moral part of the community, need to think very carefully about making that decision with his patient. What happens if the attempt of suicide fail? Then what? Will the call be made to 911 to complete the task? 911 will be made to take them to the emergency room. Then what? Is the emergency room physician to assist and administrate extra doses? There are currently 8 to 10 states that have physician-assisted death. California, Colorado, the District of Columbia, Hawaii, Montana, Oregon, Vermont, and Washington State. And I believe that it is only in Hawaii that the patient is expected to undergo psychological evaluation before being admitted to this program. Death with dignity in the United States. As of January 1st, 2019, as you can see on the slide, California, Colorado, District of Columbia, Hawaii, Oregon, Vermont, New Jersey, and Washington have death with dignity statutes. In Montana, physician-assisted dying has been legal by the state Supreme Court ruling since 2009. Areas of healthcare ethics that may be affected. In order for us to truly examine the issues of physician-assisted death, we need to look at the ethical areas that may be affected. Patients facing end-of-life issues may be concerned about their appearance, which can be related to egotism. Depending on where the cancer is, there may be surgical removal of body parts. The next ethics that we may need to look at is autonomy. That one will come into play. But just because the person is able to make their own decision, will it be the right one for the right reason? We will also look at the principle of double effect. This is used in medical ethics. This is used when dealing with euthanasia. This is looking at the decision. Is it good or evil? And I'm going to refer you at this time to our textbook, by Morrison and Furlong. And we also have to remember that it was Kant that argued that free will makes ethic possible. This topic must also be looked at in the spiritual aspect. Most religion prohibits suicide, assist or not. And some culture also disagree with the notion of taking one's own life regardless of the circumstances. The Ethics Committee of Hospitals should include physician-assisted death on the annual education for the staff in order to prepare them for the future. As more and more states make this practice legal, we can expect to see more failed attempt legal suicide because the medication was not enough, or the last second the person changed their mind, or family members call 911 and then have them taken to the hospital. As the baby boomers come up to retirement, even if no other state jump on this wagon, we may see a steady migration to the areas that do offer that type of service. And of course, with the growing demands for physician-assisted death, we very well may see this ending up on insurance benefit package. Conclusion. This is a topic that requires more in-depth studies. It encompasses a lot more and will eventually touch each of our lives on different levels. And no amount of ethics will change people's lives, especially if they think that this is their right to have physician-assisted death if they want it. And relatives may be able to say that was what their relatives wanted if that person is unable to voice their own opinion.